Scoliosis may cause by: first, congenital scoliosis, which is present from birth, is caused by the spine bone not developing properly in the pregnancy. Second, neuromuscular scoliosis is caused by an underlying nerve or muscle disorder, such as cerebral palsy or muscular dystrophy. Third, degenerative scoliosis, which is a result of spine deteriorating with age, is a condition that affects elderly people. Technically, the main cause of scoliosis is still unknown, but your gene plays a big part of it.
Treatment. In treatment, orthopedic doctors have several issues to assess that can help them to determine treatment options. Spinal maturity. Is the patient's spine still growing and changing? Degree and extent of curvature. How severe is the curve? Healthcare providers measure scoliosis curves in degrees. A mild curve is less than 20 degrees. A moderate curve is between 25 to 40 degrees. A severe curve is more than 50 degrees. And how does it affect the patient's lifestyle? Next is location of curve. According to some experts, thoracic curves are more likely to progress than curves in other regions of the spine. Possibility of curve progression. Patients who have large curves prior to the adolescence growth spurts are more likely to experience curve progression. After these variables are assessed, the following treatment option may be recommended. Observation. In many children with scoliosis, the spinal curve is mild enough to not require treatment. However, if the doctor is worried that the curve may be increasing, he or she may wish to examine the child every 4 to 6 months throughout adolescence. In adults with scoliosis, X-rays are usually recommended once every 5 years, unless symptoms are getting progressively worse. Bracing. Braces are only effective in patients who have not reached skeletal maturity. If the child is still growing and he or her curve is between 25 degrees and 40 degrees, a brace may be recommended to prevent the curve from progressing. There have been improvement brace design, and the newer models fit under the arm, not around the neck. There are several different types of braces available. While there is some disagreement among experts as to which type of brace is most effective, large studies indicate that braces, when used with full compliance, successfully stop curve progression in about 80% of children with scoliosis. For optimal effectiveness, the brace should be checked regularly to assure a proper fit and may need to be worn 16 to 23 hours every day until growth stops. Surgery. In children, the true primary goals of surgery are to stop the curve from progressing during adulthood and to diminish spinal deformity. Most experts will recommend surgery only when the spinal curve is greater than 40 degrees and there are signs of progression. The surgery can be done using anterior approach throughout the front or posterior approach throughout the back, depending on the particular case. Some adults who were treated as children may need revision surgery, in particular if they were treated 20 to 30 years ago, before major advances in spinal surgery procedure were implemented. In general, surgery in adults may be recommended when the spinal curve is greater than 50 degrees and the patient has nerve damage to their legs and or experiencing bowel or bladder symptoms.
The basic principle of scoliosis surgery were proposed nearly 4 decades ago by Goldstein and Moe. These include fuse all the vertebrae within the primary or major curve, fuse from cephaloneutral to caudal neutral vertebra, and caudal end of fusion must lie in the stable zone. While many of these principles are still valid, these have been fine-tuned with the advent of modern instrumentation techniques. Particular attention has been paid to reduce the length of fusion at the caudal end in the lumbar spine.